Bismillahirrahmanirrahim. Assalamu alaikum. I am Gulmaida Arbab, student of BS Radiology at Sarhad Institute of Allied Health Sciences. Today I am here to give a presentation on poliomyelitis. What is poliomyelitis? Let us talk about poliomyelitis. Polio is a gray matter, myelitis and inflammation of spinal cord. Poliomyelitis is a viral disease of destruction of spinal nerves or spinal cord. Further, we can talk about the history of poliomyelitis. Poliomyelitis first described by Michael Underwood in 1789. First outbreak described in US in 1843. Most affect children under the age of 5 years and so on. Poliovirus is RNA virus and it is not enveloped. Further, there are two classifications of poliomyelitis. The first is paralytic poliomyelitis and the other is non-paralytic poliomyelitis. Paralytic poliomyelitis is a permanent poliomyelitis and symptoms initially like flu and then loss of muscle and flex. After that, muscle spasm, then loss of happiness, muscle pain, etc. And most cases, ratio of paralytic poliomyelitis is under 80 to 99%, 80 to 90%, and non-paralytic myelitis, symptoms like flu-like symptoms, and most cases under the 2 to 3% are the most of the cases. After that, we will talk about the incubation period. There are further types of paralytic poliomyelitis. Three types of poliomyelitis, paralytic poliomyelitis. The one is spinal, the other is bulbar poliomyelitis, and the third one is spinal bulbar poliomyelitis. Spinal poliomyelitis is the infection disease of the spinal cord, and the bulbar poliomyelitis is the infection of brain stem, and the bulbar spinal poliomyelitis is the infection of both, combination of bulbar and spinal infection disease. After that, there is incubation period of non-paralytic poliomyelitis is 3 to 6 days, and paralytic poliomyelitis is 7 to 21 days. Now, for further information, I would like to call my fellow Aisha Noor to proceed.
Assalamu alaikum. Thank you, Gulmaida, for further continuation of poliomyelitis. I would like to discuss causes, treatment, prevention, and symptoms. Okay, causes. Poliomyelitis is caused by the poliovirus. 1. Transmitted person to person. Infected people matter entering the mouth, or less commonly through contaminated food and water containing human feces. It multiplying in the intestine. Okay, the symptoms of non-paralytic poliomyelitis. Non-paralytic poliomyelitis is temporary poliomyelitis are fever, vomiting, headache, fatigue, meningitis, neck pain, etc. Back pain, irritability, abdominal pain, pain in the arm is a few of the symptoms of non-paralytic poliomyelitis. Symptoms of paralytic poliomyelitis are one of the permanent paralytics. Initial signs and symptoms are fever and headache. After a few weeks, more severe symptoms will appear, such as loss of reflex, severe muscle aches, or weakness. Okay, how we can diagnose? The doctor may diagnose by looking at your symptoms. The doctor will perform a physical examination, look at neck and back stiffness, abnormal reflex, difficulties lifting the head when you are flop. Okay, sudden paralysis which is temporary or permanent, deformed limbs, especially in the hips, ankles, feet. How we can treat? No cure exists for polio. The aim of treatment is in increasing comfort, speeding recovery, and preventing complications. portable ventilator to help with breathing, physical therapy to prevent loss of muscles, function and deformities. Okay, a confirmation is necessary when it is polioviruses or not. A confirmation is made by taking a sample of throat secretions, stools, cerebral spinal fluid. We can test it and after that we diagnose this is a poliomyelitis or not. Okay, according the vaccination schedule presented by the Center for Disease Control and Prevent, children should get one dose at 2 months, 4 months, 6 to 18 months, and a booster dose between age 4 to 6. I will call for the winding up Gul.
The population of the worldwide poliomyelitis in 1800 there was 350,000, but nowadays in 2021 it reduces. In 2022 it is more reduces. Only 20 cases were there. But now in the end, I would like to say that poliovirus has been a challenge to many lives. But on the day of polio, the World Polio Day, let us promise to fight against it and throw it away from our lives. Warming wishes to all of you on the World Polio Day. Thank you.
Bismillahirrahmanirrahim. डॉक्टर सलीम शाह, हॉस्पिटल डायरेक्टर इरफान जनरल हॉस्पिटल। सबसे पहले मैं आप सब लोगों का शुक्रिया अदा करूंगा जिन लोगों ने इस कैंपेन में हिस्सा लिया। असल में हमारे हॉस्पिटल का जो मिशन है वो ये है कि जिसने एक इंसान की जान बचाई गोया इसने पूरी इंसानियत की जान बचाई। तो इस हवाले से ट्रीटमेंट तो होती रहती है, लेकिन कुछ ऐसे बीमारियां हैं जिसकी हम रोकथाम कर सकते हैं। उसके लिए ज़रूरी है कि आप माशरे में लोगों को अवेयर करें, आगाही दे दें। और इस सिलसिले में ये आज पोलियो डे के हवाले से आपने बड़ा अच्छा प्रेजेंटेशन भी की माशाल्लाह, और एक वॉक भी हमने अरेंज की है। तो ये हमारा सिलसिला जारी रहता है थ्रू आउट द ईयर। जो भी मुनासिब है डिजीज़ के हवाले से उसको हम सेलिब्रेट करते हैं और हमारा स्टाफ उसमें हमारे साथ तावन करता है। ये हमारी सोशल रिस्पॉन्सिबिलिटी है और ये डिज़ीज़ के बर्डन को कम करना है। ये जो हॉस्पिटल के डिज़ीज़ बर्डन है उसको कम करने का एक पार्ट है। तो आप सब लोगों का बहुत बहुत शुक्रिया। थैंक यू वेरी मच।
Assalamu alaikum. I am Hajra. I am currently working as a laboratory in charge in Irfan General Hospital, and I would like to thank Aisha and Gulmaida for such a beautiful presentation and contributing with us. Thank you so much.